Kristen, hello.
Hello.
I looked at your daughter's CT scan and X-ray images, and she has the condition craniosynostosis, as we suspected. The images show that her suture bonded prematurely.
Okay.
Baby skulls have these openings we call sutures. They allow for the brain to grow. In the first year, the brain triples in size, and it continues growing until they're about 12 years old. Can you tell me more about those symptoms?
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They said I should let her cry, that I shouldn't spoil her, but I was sure something was wrong. She's in a lot of pain.
She has craniosynostosis. The shape of her skull, though, is not, it's not all that abnormal. It's actually close to being normal, and that probably made it harder for them to diagnose it. It's a complex situation, and many doctors don't recognize the symptoms. Just to let you know a little more about what goes on. When the brain is in the process of growing, it needs to be able to push the skull bones apart in order to make room for the growth. If there's constriction of that growth, then the brain is closed in upon and it's squeezed. It causes a condition called intracranial pressure, and that can be extremely painful.
So what are the options?
Well, we've got to get rid of that intracranial pressure, and we can only do that with surgery.
Surgery? That sounds really dangerous. My pediatrician said it could be fixed with a helmet.
Well, if the sagittal suture hadn't fused, then we might be able to use a helmet, but it's too late for that. It's too late for that.
Okay.
Every surgery has risk, as you probably know, especially has surgeries. Your daughter's healthy otherwise, and that's good. It means there are less risks for her. We'll double check to make sure she doesn't have any heart conditions or lung conditions which might get in the way.
I'm just really concerned. What exactly will this surgery involve?
Well, there are two options. We can go with the traditional approach or with the minimally invasive procedure, and I'll explain the difference. The traditional approach, we start with an incision just below one of the ears. We go to the other ear, moving across the top of the head. That's the only scar there is, for the most part. The hair usually hides it. Once the incision is made, then the affected areas of the skull are removed. We reshape those bones. We create an opening for the brain to grow. We replace those bones in a proper place. And when we're all finished, the incision is usually closed using dissolving sutures.
This sounds really difficult.
Yeah, it's complicated. It's a complicated condition, and it requires the expertise of a number of different specialists working together.
If Jenny has this surgery, do we know that she'll be without pain afterwards?
Unfortunately, there's not a guarantee of that. Some patients have made complaints of some pain afterwards, but it's usually addressed with medicine. In some situations, there are patients who require second surgery, but that's extremely rare because the success rate is very high. It's over 98%. We've been doing this for many years really well.
Sorry for so many questions. I just want the best choice for my daughter. After all the bad experiences, I want to be sure. So what about the other procedure, the minimal one?
The minimally invasive procedure, yeah, that's endoscopic, and it involves using a suture. We only do this on young babies when they're 6 months or younger, usually. We use an endoscope to open the suture. The procedure takes an hour. She'd have to spend a night in the hospital. After that, she could probably go home. It's a much simpler procedure. It can be equally successful when the baby's very young.
And she would have to wear a molding helmet?
She'd have to wear a helmet after that for about 6 months. We'd have to check it every 3 months to make sure that the sutures aren't closing early.
Is it painful?
It's not painful. It's custom made. Success of the procedure depends on how frequently she wears that helmet. After about 6 months, we know if the procedure is working, if the growth was normal. If it's not, then we may need to do another operation. That second surgery would be the longer traditional one. Both types are complex, and we have to work with a team. My team includes a plastic surgeon and a neurologist.
This is all overwhelming. How do I decide what's best for Jenny?
It's a lot to think about.
So you're pretty sure she needs surgery. A helmet alone won't work.
Yeah, she's had fusion, which has to be corrected surgically.
Okay. How do I get more information?
You should probably ask your pediatrician. Let me give you some information, though, in this brochure that gives you some details about the condition and your treatment options.
Okay. Thank you.